Hello everyone, my name is Tatiana Pereira. I'm a speech and language therapist and a PhD student in language sciences at the University of Aveiro, Portugal. For me, it's a great pleasure to introduce you to this project that I am developing together with my supervisor, Dr. Marisa Lousada, and co-supervisor, Dr. Margarida Ramalho. I will present the first results of parents and teachers' perceptions after the implementation of the Pragmatic Intervention Programme. PICP is the acronym that we use here in Portugal. These results are incorporated in an ongoing study that aims to determine the effects of the PICP in children with autism spectrum disorder and developmental language disorder. And this is our dream team. Children with autism spectrum disorder and developmental language disorder frequently face pragmatic difficulties that have a negative impact on learning, socialization, and mental health, so early intervention is crucial, and the inclusion of caregivers and other communicative partners in the intervention process is essential to improve language outcomes. Stammer et al. Developed a parent satisfaction survey to analyze the parents' perceptions after the implementation of Project Impact in a community trial. Considering that research on parents' and teachers' perspectives on the perceived effectiveness of pragmatic language interventions is scarce, we decided to adapt the parent satisfaction survey developed by Stammer et al. To analyze the parents' and teachers' perceptions of effectiveness after the implementation of the PICP. Data were collected as a part of the PICP research project, and ethical approval was previously granted by an ethics committee. Data from 30 participants among parents and teachers were collected immediately after the implementation of the PICP. During the intervention period, each child received 24 PICP-based intervention sessions that were given twice a week for 1 hour by a speech-language pathologist with in-depth knowledge about the program content, implementation, and previous clinical practice providing intervention to children with pragmatic impairments. All sessions were provided face-to-face in a naturalistic context that was the kindergarten of each child, and beyond the child and the SLP, other communicative partners were also involved. Despite the use of other outcome measures to analyze the effects of the PICP, in these presentations we are only focused on parent satisfaction survey. The survey includes 11 statements that you can read below about the intervention impact and satisfaction that were individually scored between 1, totally disagree, and 7, totally agree. And we reach very interesting results. The average score obtained from parents' perspective was 6.73 and teachers' perceptions 6.42. As you can see, all the statements had an average score above 6, which were very good results. So, despite the differences in the studies, the results obtained from parents and teachers were similar to those reported in Stammer et al., where parents implemented the intervention. Parents and teachers agreed and considered PICP an appropriate and effective intervention for preschool-age children with DLD, A and ASD. And in this line, we know that evidence-based improvements in multiple contexts are essential to ensure generalization, and therefore caregivers' perspectives should be considered as a valuable additional outcome in future trials and clinical practice. Thanks for your attention. See you soon.